A very good morning to all the Facebook and YouTube viewers out there. So, today we are live with yet another World Awareness Days. So, today is World Obesity Day, and we have here with us our speaker, Dr. T. Tamil Arasu, MD in Yoga and Naturopathy, working as Assistant Professor and Medical Officer, heading the Department of Emergency Medicine at our college, JSS INYS. So, Sir will be providing inputs on the topic and the theme of the World Obesity Day, that is 8 billion reasons to act on obesity. So, let's see and hear out the health awareness talk on obesity. Over to you, sir.
A very good morning, one and all. I am here to deliver my insights about obesity on this World Obesity Day. So my topic is related to the theme of this World Obesity Day 2026, the 8 billion reasons to act on obesity. As we all know, obesity is the metabolic disorder which acts all other metabolic disorders like obesity, liver disorder. So on this World Obesity Day, we are here to set a protocol for how to control the obesity and how to prevent this obesity to becoming a global burden. So now world obesity is becoming a global burden with a projected impact of 50% global population by around 2035. So around 2035, so 50% of global population will be living with obesity. So this obesity is considered as a complex, a chronic disease shaped by our body system and by our environmental factors. So which require a collective action from each and every person in this world to get rid of this obesity as a global burden. It's not an individual task. It is becoming a global burden, and every person, every community, and every system will have to come together and have to work together integratively to get rid of this global burden. So initially it is an individual problem. So now it is becoming a very big global problem. So why action on obesity matter? Why we have to see obesity as a serious issue? As obesity is a very chronic condition, it's a relapsing disease. So once you follow any certain diet, once you follow any certain treatment, once you take any certain ballistic surgeries, so your obesity will come down, your body weight will come down, but it has higher chance of relapsing. So obesity is such kind of a disease which have a higher chance of relapsing, which is influenced by various factors. Example, a biological factor within our body, we have the behavioral patterns, the environment that we live in, and the inequalities. It's not just only this simple lifestyle, but it encounters all other aspects which will cause the condition a relapsing one. So once you get treatment, it will your body weight will subside, your body fat will come down, but again, it is a higher chance of relapsing. So the action on obesity really matters in this current situation. So as a global crisis, I already said before, so 1 in 8 people worldwide were living with obesity in 2020. So more than 1 billion people. As we are having an 8 billion people population, so in that more than 1 billion people are living with obesity. So 1 in 8 people worldwide were living with obesity. So in that specifically, the obesity among adults have been doubled since 1990 due to the lifestyle, due to the food habits. Whatsoever reason. So in the obesity in adults has been doubled since 1990. Especially the most alarming situation that we face today because of obesity is it's an increased case in the youth population, in the adolescents and in the adult population. The prevalence of obesity has been doubled, especially in adult. It is doubled in adult. In adolescent, it has been quadrupled. So 4 times it has been increased since 1990. So due to the lifestyle, due to the way we live, due to the food habits we have, due to the environmental factors, due to the biological patterns we develop within our body. So everything contributes to the development of disease, not at all reducing the disease. So since. So, so more than the biological factor, so other social factors influence the development of disease and the prevalence more in adult and in the adolescent age. The social factors include the stigmas that we have, the body shaming that we do to the obese individual, the weight biases we have, the discrimination in healthcare, and the society hinder effective preventive and treatment outcomes has been reduced because of a certain social stigmas we have, a certain discrimination we have between with the individual with the body weight. So that it also plays an important role in treating the obesity. So that the theme for this year apps with the 8 billion reasons to act on obesity. So each and every individual has to work on it to reduce the prevalence and incidence of obesity in the near future. So every person, every community, every systems has the role to play in building a healthier future. So it's not depending on the system. So our system is superior than the other system. It's not like that. So every system has to work together with the common goal of reducing obesity in the near future. So as we see in the current picture, so as we all know, said before, so 1 in 8 people. So it has burden has been increased year by year. So now it is alarming. It is more alarming. As you can see, so adults overweight, it's around 2.5 billion. So adult with overweight in globally, it's around 2.5 billion. So 43% of global adults are living with obesity or overweight condition. So children and adolescents, if you can see, so children and adolescents between the age of 5 to 19, if you can see around 390 million children and adolescents are living with overweight, including 160 million with obesity. So overweight, they are living with 390 million. In that, 160 million are living with obesity. So this overweight and obesity is based on their BMI, so body mass index, based on their height and weight. So how their BMIs are there. So based on the BMI, the category has been divided. So overweight, obesity. In obesity, we have obesity grade 1, grade 2, and grade 3 based on the BMI. So if the BMI is 30 to 35, it comes under obesity grade 1. 35 to 40, grade 2. So more than 40 BMI, it's called morbid obesity or grade 3 obesity, which is more severe. So which will lead to other complications. So children under 5 years. So under 5 years at this global survey at the year of 2024, so 35 million children under age 5 are overweight and obese. So it's much more alarming. So even with this very small age, the obesity is becoming more prevalent because of their world happenings, because of our lifestyle changes, because of the food habits, because of their reduced physical activity, increased screen time. So whatsoever reason, obesity has been increased at the age of under 5 years, which is much more alarming. Even more alarming state is that it's not only the state of a developing country, only the developed countries. So obesity is a burden for globally, either developing or underdeveloped or developing countries, developed countries. So everywhere, obesity is becoming a very a global burden. So in this, you can see, so adult obesity has been doubled. Adolescent obesity has been quadrupled since 1990. You can see the difference. So 1990 prevalence and the 2022 prevalence. that you can see report by the WHO. So why this obesity is becoming more alarming? Because obesity is a metabolic condition which is characterized by increased adipose tissue deposition in their adipose tissues. So fat deposition in their adipose tissues. So which will trigger so other metabolic disorders in their body. So if you have an obesity, you have higher risk for developing all other metabolic disorders in your future. So most prevalent complications a obesity person can develop is the hypertension or increased blood pressure, because so heart has to pump more blood to reach all parts of their body. So in the dyslipidemia, increased cholesterol level, increased LDL level, increased HDL level, VLDL. So HDL, high density lipoprotein, LDL, low density lipoprotein, VLDL, very low density lipoprotein levels will be altered in their blood. So due to the high fat content in their body. So which leads to dyslipidemia. So this dyslipidemia, so the fats, so HDL, LDL fats get circulated in their blood. They have the higher risk of getting a heart attack or the stroke. So blood vessels have will develop the tendency to form the plaque, so which causes blood stagnation, which got infraction, so that heart attack, a stroke are much more prevalent in obese patient than the normal patient. So which has been the risk of developing stroke, risk of developing heart attack is doubled in the patient with obesity than the normal patient. So other component, type 2 diabetes. So obesity, increased fat content in the body will develop insulin resistance, so that the person will develop a type 2 diabetes. So type 2 diabetes, if the person first has type 2 diabetes, has tendency to develop obesity, increased fat deposition in their body. If the person has obesity at first, will have a high tendency to develop the type 2 diabetes or insulin resistance he will develop. So then other complications of the liver, the major organ for metabolism, will get affected due to the high fat content in the body. So fat does not get utilized properly. It get deposited in the adipose tissue, so that the high chance of developing as a steatotic liver disease is increased. So steatotic liver disease. So metabolic due to metabolic reason, steatotic liver disease will develop in the patient with obesity. So other consequences due to increased body weight. So they have higher risk of developing all the musculoskeletal disorder. All joint problems are start to develop over the age. So osteoarthritis, mainly the knee joints, the hip joints, the ankle joints, because the major weight-bearing joints will get affected, mainly the knees. So osteoarthritis knees are more common in the patient with obesity. And so recent studies have established a close relation of obesity with cancers. So around 12 to 13 types of cancer have a direct link with the increased adipose tissue and with obesity. So some of the examples I have given: so endometrial cancer, breast cancer, ovarian cancer, prostate cancer, liver cancer, gallbladder cancer, kidney cancer, and colon cancer have higher association with obesity. So obese patients have higher risk of developing these cancers in their body. And other respiratory diseases. So due to high increased body weight, so the patient may feel dyspnea over a period of time. So with a small exertion, he may feel dyspnea. And sleep apnea is the most common problem in the patient with obesity. So sleep apnea, so they will go for sorry. So they will go to the apnea state during sleep. So they feel a sudden stoppage of breathing and they will wake up suddenly in between the sleep. So this sleep apnea is very big alarming condition associated with obesity. So due to the increased fat deposition around their neck, around their throat, in their chest region. So when they are sleeping and they are lying down, so there's a tendency to develop a breathlessness due to the stoppage of breathing. So this sleep apnea. Then other mental health. So due to obesity, so most of the adults, most of the adolescents are going into for a mental depression or mental anxiety due to the social handling, because of any stigmas they have, increased body weight, ridiculous figure they have, body shaming others do on them, their friends do on them in their schools, in their colleges, which lead to more depression and anxiety, and bullying and stigma we have around due to the increased body weight, the stigma of maintaining a perfect figure. So which and all contributes for a mental health destruction in the patient with obesity. So discrimination with a normal adult and an obese adult, with the normal children, obese children, so that the person will develop more depression, anxiety in their life, and it will reduce the even the quality of life of that obese individual will be reduced because of that social stigma that we have around in our society, in and around the world. So due to that, the mortality impact, so death rate has been more related to the obesity. So around 3.7 million deaths have been reported with a high BMI from non-communicable disease in 2021. So around 3.7 million deaths, which was mostly associated with obesity. So another alarming complication, health issue, health impact that obesity develops is the cardiovascular problem that I already discussed due to the plaque formation in the blood vessel due to increased LDL level and reduced the HDL level in the blood. So it causes heart attack, which is the major reason for death rate. So major reason for death rate worldwide. So other than the physical health impact and psychosocial impact that we have, so other impact, the globally the faces are the economic impact due to for the healthcare. So the obesity will lead to multiple complication, multiple disorders, so diabetes, hypertension, dyslipidemia, heart attack, stroke, musculoskeletal disorders, cancer, chronic respiratory disorders. So that the global economical impact are much more. So they have to spend more money on healthcare. From the past, they are doubling the amount to be used in the future for only healthcare, because so obesity plays a major role of increase the burden for in the economical aspect also. So you can see around 2030, so economic cost will be around $3 trillion for the healthcare they have to spend to maintain an optimal level of health in their for their people. So it will go doubling. So around 2050, 3 in 1 people will be obese. So now it is around 1 in 8. So it will go to 1 in 3. So it will be much more dangerous. So in this, you can see around 2035. So nearly 50% of global population is projected to live with overweight or obesity. So half of the population are going to live with obesity by 2035. So you can see the economic burden. So now they are using around 2 to 3 trillion for healthcare. But if it goes to 2060, they have to spend around $20 trillion only to healthcare to maintain a normal health in their for their people. So much impact the obesity has directly and indirectly on the healthcare, on the physical body, on the mental aspect, and on the economic aspect. And globally, we have a much more impact of for obesity. So which has to be addressed at the earliest to reduce the physical complication, the mental complication, and the economic burden to the government and to the people. So what we can do? So what and all factors are there to support the so people living with obesity? So PLWO. So people living with obesity has to be supported. That obese patient has to have a easy access to the healthcare, to get their condition treated, to get their complications treated, to have a regular follow-up, to have regular checkups or medication according to their condition and their complication. So they has to be supported well by their closed circle, their family, their friends, and the healthcare system we have nearby them, healthcare professional doctors they meet. So everybody should care them, everybody should support them in their journey to reduce the body weight and to maintain a fit body without with a reduced adipose cells, adipose fat. So the burdens they face are the outer circle. So adverse life event, any psychological traumas they face, any loss they face in their family, which leads to economic so psychological stress. So that they will not follow the proper food habits. They will not have any proper environment to live in. So that it develop obesity, the social stigmas we have, that stigmas will block them to access to the hospital. They will feel so much inferior that they are looking very much fat, so they can't able to go out, they can't able to go to the doctors. So everybody start bullying them. So that stigma and cultural influences each community has. The marketing that we do in the television, in the ads, they will do. So fit body is perfect. It is beauty. So obese body is not beautiful. It's ugly, like that. The marketing we are seeing. And socio-economic aspect. So their way of living, their socio-economic status, the job they are doing, the family they are living, the place they are living. So everything determines directly and indirectly the mindset of an obese person, whether to feel safe with the obesity, or they are feeling so much inferior about their body weight. So some community are uh, some persons are very much inferior. They will not able to walk outside, they will not able to come, they will not go to hospital for obesity, because they feel very inferior, that they have more body weight, they are looking very fat, they are looking very ugly. So still that stigmas are prevalent in some areas, so that it hinders the basic medical care, health care that person can take. So that it can develop into other complication and becoming a burden to him, to that person, and to the family, and to the society, and to the government also. So what can be done? So early diagnosis. So early diagnosis we can do a holistic approach. So every system combined together. So all the treatments. So every treatment has its positive impact on obesity and reducing body weight, reducing complication of the obesity. So all the system come together and make a protocol, and make a treatment plan, and we can apply for the patients, and we can reduce weight, and we can reduce the obesity burden in the society and globally. Holistic approach, phenotyping. So what is the main reason for developing the obesity? His genetic nature, his familial history. So everything are taken into account, and proper management has been planned for each and every individual, and for future perspective they are following. So early diagnosis, early treatment, and government aspect, they have to do early policy making for the obese patient and the complication developed due to obesity. So how to reduce obesity from the childhood, in the adolescent, in the adult, to have a healthy life, and a preventive aspect. So how to be preventive without developing obesity. So that has to be encouraged, and that has to be followed. So when it comes to our system, naturopathy, so naturopathy and yoga, so our naturopathy is based on the 6 basic principles. So that you can see the vis medicatrix naturae, which means the body's own healing power. So each and every body has its own healing power. So whatever changes happen, whatever any environmental changes, any artificial changes happens in and around the body. So body tries to keep a homeostasis, keep to maintain the health in an optimum level. So body has its ability to do. So we are not. So that is vis medicatrix naturae, body's whole healing power. So then the toli kasam. So naturopathy believes that we have to treat the root cause, not the external symptoms. So external symptoms are the reflection of the disease that we have in our body. So we have to find out the root cause of the disease, and we have to treat the root cause, not only the complication, or not only the symptoms that we treat. Then the primum non nocere, first do no harm. So just prioritize a low risk, a least invasive treatments to the patient. So there are so many treatments with low cost and least invasive treatments that has a better effect in obesity, so than invasive treatments and high risk treatments. So that we prescribe low risk and less initiative treatments. So simple dietary change, a simple lifestyle change, a simple physical activity have a very great impact on obesity. So that our naturopathy principles follow. Then doctor as a teacher. So specialty in naturopathy is the doctor act not only as a doctor and as a teacher. So they will teach the patient so what to do, what not to do, and how to do that. So we will teach that. So we will empower the patient. We will make the patient to know about themselves, We will make the patient to know about their disease and what can be done for the disease and what should not be done for the disease. So how to maintain the health, how to improve the health. So like that, everything will be taught to the patient. The cooking methods, the food, what food have to be taken. So what food should not be taken, and how to eat that food, when to eat that food, and how to cook that food, then how to be stress free. So like that, the behavioral changes, everything we teach to the patient. So which has a more impact on the patient health than we are giving just a treatment and they're coming and we are just giving treatment and they are going. So than that, so the patient has more impact once the doctors start teaching the patient. So what to do, what not to do, what is the disease they have, what things we can do as a treatment. So then the totem, which means we have to treat the whole body. So basic principle is from naturopathy is we have to treat the whole body, not an individual system. So obesity is not any system specific, is a multi-system. It involves the whole body. So treating the whole person for obesity is the main. We can't able to treat any particular, we can't able to treat only the liver, we can able to treat only the stomach for obesity. We have to treat the whole body to reverse this condition. So we have to find the interconnections. So we have the interconnection. So our body is an interconnected and network. So every system is connected to the other system. So there is no system which is acting autonomously, acting individually. So every system on our body is connected to each and every system. So in that way, we will study that in the psycho and neuroimmunology. So endocrine system, nervous system, immune system. So all the other systems has been interconnected. So our GIT is connected to our brain. Our sensory is connected to our GIT and brain. So all other system is connected to one another. So that treating the whole body is the only way to treat the obesity and all other conditions also. Then prevention. So prevention is the best cure. Prevention is better than cure. And prevention is the best cure. So preventing the disease from developing is the first line of cure that we can achieve through naturopathy. For all the NCDs, for all the non-communicable diseases, prevention is the main first step we have to take, then going for the treatment. So try to prevent, so try to overall health through some naturopathy practices to avoid the disease from developing in the body. So with these basic principles, so naturopathy approaches the obesity and we have a better results that we achieve in obese patients and in complications. So naturopathy treatments, it involves a lifestyle modification, dietary changes, some physical activities. So like that can be added. So whole foods, we can prescribe minimally processed food, fiber-rich food, protein, rich foods we can add, reduced sugar intake, and improved physical activity, some strength training, some daily half an hour to 1 hour of physical activity will improve their fat utilization, glucose utilization, which will reduce the fat deposition in their body and reduce the sedentary time. Make the patient to move more, to work more without sitting simply, as without lying down, without sleeping in the day. So that sedentary kind of lifestyle has to be changed. If they are working in IT, they are having a prolonged sitting, so they have to stand and walk in between. So they have to move their body so that muscle will be activated. If the muscles are activated, so more glucose has been utilized. More glucose has been utilized, fat will be utilized, so that it will be helpful in developing obesity also, and it also helpful in reducing the obesity also, and having a good sleep. So good sleep will improve the overall working of the systems, so which will improve the circadian rhythm. So that will reduce the psychological stress, psychological anxiety. It will improve the work efficiency of that person. It will improve the efficiency of the muscular activities. So everything are interconnected and interrelated. So mainly the food we have to focus on, mainly the physical activity we have to focus on, and the sleep we are getting. And then we comes to the psychological aspect. So their behavioral aspect and mind-body connection, if we see, so we have to motivate the person. So motivate the person why they are doing and what they are doing. You have to motivate. And mindful eating. So when we are eating, not just looking into the screen and eating. So you have to do a mindful eating. So mindful eating means we have to feel the food. We have to feel the taste of the food. We have to chew it nicely and we have to eat. So mindful, our mind should be in our food, what we are eating and how we are eating, and not in watching TV or watching phone while eating. It's not at all recommended. Then comes with the yoga. So yoga is the integrated part of natural. So naturopathy and yoga. So yoga is much more has to do in person and more physically than and mentally. So both yoga acts both physically and mentally, and little more extra to the spiritual level. It will act. So it will calm down your mind. It makes your body move. It makes your body flexible, so that our health has been improved. So for obesity, we have certain asanas that we can do. We have certain asanas, certain pranayamas, breathing techniques, certain mudras, bandhas, and meditation techniques, which can be followed by the patient. So which will improve the fat mobility and fat utilization. The asanas, the practices we do will increase the fat mobility, fat utilization, and it will maintain the joint flexibility. So musculoskeletal disorder due to obesity has been, which can be well managed through yoga practices and breathing techniques, the pranayamas, other breathing techniques, breath work, meditation that we do will calm down our mind, which will reduce the stress level. So the stress-induced fat deposition, stress-induced obesity development has been reversed with a proper yoga practice, yoga and pranayama practice, and building a social network. We are developing a good social contact, good friends around us who knows about our condition. It just Obesity is just like another condition. It's not anything to do shaming or follow any stigma regarding the shape of their body. So building a social support network, so which will helpful to reduce the cases of obesity, and improving dietary fiber in foods. If you see particularly, we can improve the dietary fiber, so which will improve the digestion, which will improve the elimination of the food we have taken, and the specific herbs that we can have: green tea, ginger, turmeric, cinnamon, which has its own benefit effect on the obesity that we have. So according to the principle, so our treatments follow these principle. So body has its own healing power. So the food we are prescribing, the exercises we are doing, so everything is not going to harm. So the first do no harm. So we are not going to strain the system. We are not going to harm anything with our treatment. So the foods that we take, the yoga practices that we do will not going to harm. It will support the system to recover it. So recover by itself. So by doing no harm, by giving the naturopathy and yoga treatments, so our body's own healing power, that vis medicatrix naturae, so the nature will start to heal themselves just by, we are just altering the way the body responds. So like the poor diet is the main reason for developing obesity. So we are correcting the diet. So sedentary lifestyle is the main reason for obesity. We are correcting the sedentary lifestyle. So we are changing it into a physical activity. We are changing the poor diet into a natural diet, a balanced diet with high dietary fibers. So like that, if we change, so body will start to respond for that in a different way, in a healthier way. So that's the a simple logic behind the naturopathy and yoga treatments. So identify and treat the cause. So we are going to identify. So obesity is the main. So patient coming with diabetes, patient coming with osteoarthritis, if they has the obesity also as their complaint. So obesity will become the prime culprit to which develops OAK, which develops the diabetes mellitus. So we'll treat the obesity, see excess body weight. So by giving naturopathy and yoga treatments, so excess body weight will start to come down as the fat get utilized more with the treatment and the diet that we prescribe. So the hormonal imbalance, the metabolic dysfunction, emotional trigger, environmental toxins, everything will be changed once we are into the naturopathy and yoga treatment. So the emotional trigger will be less. If they are coming and staying in our hospital, the emotional trigger will be less. They will be calm they will get a calm and serene environment. So it will change them psychologically, which will motivate them to follow the treatment to reduce the body weight, reduce their body weight. Then we are going to teach them so how to do some simple treatments in their home. We will teach them how to do yoga, how to do pranayamas, breathing techniques. So what and all you can do. So how you can do like that, we are going to teach them. So they are advised to follow them at least for minimum 3 to 6 months and for their lifetime. We are teaching it as a lifestyle. So try to incorporate in their lifestyle. So daily 1 hour yoga, a daily walking, daily physical activity. So having a healthy diet, a balanced diet, a fiber-rich diet. So that we are teaching to make them as a lifestyle from thereafter. So that a person will know how they can maintain a good health. And we are obviously treating the whole body, not a particular part. The treatments that we give will going to treat the whole body. So the food that we are eating is going to treat the whole body. The treatments we are give, the yoga, breathing exercise. The breathing exercise not only for the lungs, it's for the whole body. It will have changes in whole body. There are so many researches has been done in validating our naturopathy and yoga treatment have a better result in particularly in obese patient and all other non-communicable disease patients. So we have a very good result as our system works on the whole body, not on that particular system. So for diabetes, not going to work only in the pancreas. It's going to work all over the body. For hypertension, it's not going to work only in their heart. It works in their whole body. So like that, our treatment works. So which will give a holistic approach, a holistic health to that individual, not only merely absence of symptoms or getting some alleviation from pain like that. So it will improve their overall health and their well-being. It will improve the quality of life in each and every patient who follows the natural yoga treatment, especially for obesity. They can able to see the weight reduction with these changes. So then prevention. So natural yoga advises how to live and what to eat, what not to eat, how not to live, how your environment should be, how your social networking should be. So how your day-to-day activities should be, how your lifestyle should be, everything will be taught, which is a form of a preventive aspect to reduce the disease and not to get into a complication. So it will prevent the complication once the patient is ready to follow all the aspects. So in that way, naturopathy yoga works in that. But as a overall, so call to action. Now, it's not about only the naturopathy yoga that going to reduce obesity. It's responsibility of all our system. As obesity is not only a local problem, a regional crisis, it's a global crisis. So each and everyone will have to come together and we have to work responsibly to reduce the obesity. So each system has their own advantage on treating the obesity so that that system has to come forward, has to make some protocols, treatments, reach out the people and try to reduce the burden of obesity by promoting and creating awareness about obesity. So what is obesity and what are the things can be done and what should not be done. So what obesity can lead to, the complications lead to by the obesity and early symptoms that develop due to the development of complication. If the person know if the person know the symptoms of the complication, so they can come to the hospital early. So early diagnosis can be done and early prevention can be done for the further complication. So the crisis developed due to obesity can be reduced a little bit. Then by creating a good social networking to maintain a good health and not to bully the obese patient, not to hurt them very personally, not to hurt them psychologically. So that has to be taught from the childhood to our children. So every aspect. So it's not only the physical aspect, not only the treatments, not only the physical development of disease, everything related to the social aspect, the mental aspect. So all the aspect has to be addressed effectively to reduce this obesity as a global burden. So we have to, the stigmas has to be reduced. So you can see the shifting has to be done from a blame to support. So we should not blame that person. So you are obese, you are not following anything, you are maintaining body like this. So we stop blaming the person with obese and we start supporting the patient with obesity. So you can reduce your weight, you can take treatments. So it will subside like that. So the blame has to be changed to the support. Then we have to create the pathway for the sustainable health that we are giving. On systemic action, we have to create a better environment, a healthier food environment. The cities have to be active. As a governmental policy, it has to be changed. From the governmental policy, it has to be implemented so that it can reach each and every individual in their country, in the world. And the person, each and every person has to ask the access to the healthcare easily. So easy access to the healthcare, which can be formed by the government. So policy, urban planning, and supportive health system has to be made as a default. So everybody has to be healthy, is their right. So it has to be ensured by the government with some policies so that the obesity will reduce in the country. Our integrated clinical guidance that we have said before, all the system has to come together. So early screening for obesity and for the complication related to the obesity, manage the comorbidities. So what are the morbidities can be? So we have to manage the comorbidities and options. So collaborative care, conventional medicine with natural support. So integrated care has to be maintained to reduce the global burden. So that we can this World Obesity Day is conducted every year to propagate about the obesity and to improve the preventive aspect of the obesity. So we can use this Obesity Day as a resource to advocate for change. We have to do some change for the obesity from today. So that for that, this day has been observed every year to create some change and to create some improvement in the society, in the person, in their physical level and in the psychological level and in the society and in the community. The people's view on obesity has to be changed. The community aspect has to be changed. Their approach to the obese person has to be changed. So that change has to be started from today so that there will be a change in the disease burden in their community and in globally. So whether you are a clinician, whether you are a policymaker or a normal individual, so everybody's contribution is needed. Everybody's contribution needed to reduce this obesity as a global burden. So not only the responsibility of a doctor. So obesity is a disease. It is the responsibility of a doctor to reduce the obesity. It's not like that. Because obesity is a global phenomena which has to be addressed by each and every individual. So prevention is first. If obesity is there, the treatment can be given and a proper support has to be given so that try to act from today in reducing the obesity. So obesity has a much more impact on the physical health. So once we control obesity, it will reduce further complication developed by the obesity so that each and every individual try to know about obesity and try to support the person with obesity, try to encourage them, try to motivate them. There is nothing about the body weight or body size. So everything is a condition which can be treated, which can be changed. So food habits, the lifestyle changes, the physical activity, a small change in the physical activity, a small change in the diet pattern, a small change in their sleeping pattern, a small change in their lifestyle pattern have a greater impact on their overall health and in for reducing and preventing obesity. So From today, let us make a pledge and let us come together and try to improve the society with less obesity. So the prediction we have seen before, around 2030, it will be around half of the population will be obese. So we have to try to reduce that. We have to try to disprove the claim that, so it will not going to happen at 2030, 50% of population will not be going to have obesity. So like that situation, we have to create and we have to work on that collectively. So thank you for patient listening. So let us all come together and try to reduce obesity. So try to support the obese person, try to make them follow treatments and try to reduce the burden of obesity in the individual, in the family, in the society, and globally. So thank you.